Do you feel like your engine is stalling, doctor? Have you started to believe that painful lie that age is solely to blame for the frustration in your sex life? It's time to talk straight, man to man, but with wisdom and science on your side. You've been sold the idea that the loss of vitality and sensitivity can only be solved with pills or resignation, but the truth is that your body is a powerful machine, and what it needs isn't a chemical solution, but a minute of stimulation in just the right place to awaken your dormant circulation. I'm Dr. Elena Castillo, and for decades, my mission has been to dismantle the myths that hold older men back. I'm not here to promise magic solutions, but to offer practical wisdom that restores confidence, connection, and potency. I deeply understand what that frustration means. For a man who has lived a life of effort and achievement, feeling his body betray him in the bedroom can be a heavy burden. For me, virility is a right at any age, and Dr. Castillo is here to remind you that it's never too late to rekindle that passion. If you're over 60, it's perfectly natural to experience moments of doubt or disappointment in your sex life. Many of my patients, successful men in their 70s and even 80s, come to me believing the problem is the inevitable decline in testosterone or simply the passage of time. But let me tell you a truth that conventional medicine often ignores. The main problem, the one blocking your performance, isn't just hormonal. It's mechanical and circulatory. Imagine your pelvic circulatory system as a hose that's been kinked and stretched taut for years due to stress, sitting for long periods, and the silent tension we unconsciously accumulate. This compression not only reduces blood flow, but also numbs key nerves in the area. It's as if the ignition switch is stuck. Relying solely on pills is like trying to put out a fire by pouring water through a kinked hose. It addresses the symptom for a moment, but it doesn't resolve the underlying flexibility or tension that's constricting the vessels. What's the practical, natural, and free solution, addressing the epicenter of that tension? Today, I'm going to reveal the location of a specific point, known in some ancient traditions as the $1,000,000 spot, a tiny button, about the size of a dime, located on the perineum, right between the scrotum and the anus. This point is the direct gateway to pelvic health, and massaging it for 60 seconds daily can transform your intimate performance, increase sensitivity, and restore blood flow in ways that supplements simply can't match. I urge you to stop making 3 mistakes that are blocking your virility. First, ignoring pelvic tension, which is the real culprit behind nerve compression. Second, blindly trusting quick fixes that only mask the problem without restoring vascular elasticity. And third, believing that age dictates the end of a fulfilling sex life. That's a myth we need to dispel today. The recovery and awakening of your vitality are within your reach, literally. Stay with me, because I'll show you the exact step-by-step process for applying this technique, how to enhance it with natural oils, and the best time of day to make the recovery of your male potency a constant reality. Let me call this point by its ancient name, the Hui Yin point, which translates as meeting of yin. It is the epicenter of a vital crossroads, not only physical but also energetic. But focusing on the anatomy that concerns us today, imagine your pelvic floor as the muscular base of a tree, the root of your vitality. If that base is permanently tense and contracted, something that inevitably occurs after decades of sedentary postures, chronic stress, or simply the accumulation of daily microtensions, the pressure translates into 2 crucial problems. First, it compresses the blood vessels, like stepping on a hose. The flow is reduced. Second, and this is the point that modern medicine often ignores in the context of sexual function, it compresses the pudendal nerve. The pudendal nerve is the main sensory and motor communication highway for your entire intimate area. When it's pinched or irritated by tense muscles, the message the brain sends for response and pleasure arrives distorted, slow, or simply silenced. The result is decreased sensitivity and difficulty maintaining firmness. What I propose is to unpin this nerve, releasing tension in the deep pelvic floor muscles through this strategic pressure point. The technique is surprisingly simple, but it requires your full attention for those 60 seconds. Remember, we're not looking for pain, but a sensation of deep pressure that leads to release. The key is not brute force, but rhythmic consistency. To perform this test, locate the point right in the center of the perineum. I suggest you do this sitting on a comfortable surface or lying down with your knees bent, whichever is easier for you. Use the pad of your index or middle finger. Instruction: apply firm, but tolerable pressure. You should feel that you are touching an internal muscle structure. Duration: exactly 1 minute, no less. Movement: begin by making slow, gentle, clockwise circular movements, gradually deepening the pressure as you feel the underlying muscle begin to soften or give way. It's a dialogue with your body. Press, hold, and gently release. Think of this process as kneading hardened clay or restoring a shock absorber that's rusted from disuse. By applying this rhythmic pressure for 60 seconds daily, we're sending a direct signal to the parasympathetic nervous system, the one responsible for relaxation and recovery. This allows those chronically tense muscles to loosen their grip on vital structures. This release allows the pelvic arteries, which carry crucial blood to the corpora cavernosa, to expand and function without the muscular interference that has been restricting them. This is not just a physical massage, it is a subtle yet powerful neuromuscular reprogramming. And when is the best time to turn this minute into a ritual? Its effectiveness increases if it's done in a calm state. Many of my patients find that right before bed or immediately after waking up is the optimal time. It's an anchor of vitality that easily integrates into your routine. To enhance this relaxing and gliding effect, I recommend using a small amount of natural oil such as fractionated coconut oil or sesame oil. These oils not only facilitate the massage, but many also contain anti-inflammatory properties that benefit the overall health of the pelvic tissue, helping to restore circulation more deeply. Remember, consistency is your only ally in this mission to regain your vitality. After just a few weeks, you'll notice a tangible difference in your body's sensitivity and responsiveness that will make you wonder why you hadn't heard about this before. But what if you lead a very active life and find it difficult to find that moment of relaxation? I completely understand that concern. We live in a fast-paced culture where pausing feels like a luxury. But here's the key. This ritual doesn't require you to isolate yourself in a spa or retreat to meditate in a monastery. It's about taking advantage of the micro moments that already exist in your day. Think of it as a quick adjustment of your internal elastic band. If you're in a long meeting, sitting at your desk, or stuck in traffic, you can practice a lighter version. You don't need the oil, you just need the intention, the deep breathing, and the mental focus on your pelvic area to tell those muscles, it's safe to let go. Interestingly, it's often the most active and responsible people, executives, entrepreneurs, those who bear the brunt of decision-making, who develop the most pelvic tension. This is because the body translates mental and financial pressure into muscular tension in the my powerhouse. It's the body's subconscious way of preparing for fight or flight, but you never physically release that energy. The piriformis muscle, the pelvic floor, and the internal obturators become chronically tense and don't relax, even during sleep. For those who need to integrate self-care into movement, I recommend a subtle technique I call the pelvic yawn. This technique is performed while seated, even fully clothed, and is completely invisible to others. Simply tilt your pelvis slightly forward, very gently arching your lower back, as if you were going to stick your bottom out a little, and then backward, tucking in your tailbone, flattening your lower back, in a very subtle and slow movement. This movement isn't a deep stretch, but a gentle rocking motion. Performing this rocking motion slowly allows the deep muscles surrounding the ischium, right where the blood vessels and pudendal nerve are most compressed, to gently stretch and contract. Don't aim for maximum range of motion, but rather maximum awareness of the movement. I suggest doing this 10 times every hour while seated. It's your silent anchor to vitality. When you practice this pelvic yawn, you are offering direct relief to the pudendal nerve. This nerve is, quite literally, the primary messenger of sensation and function throughout the genital region. Think of it as the fiber optic cable that connects the brain to the hardware. If that cable is being pinched, no matter how motivated your brain, the software is, the signal will never arrive with the necessary strength or clarity. the chronic, even mild constriction that tight muscles exert on this nerve, and the pelvic arteries is the main reason why the response feels muffled or delayed. By practicing the 1-minute ritual and these micro-adjustments to the pelvic floor, we are removing that constant pressure. Circulation improves because the muscle no longer acts as an intermittent tourniquet, and the nerve signal is transmitted without interference. The goal is to restore the permeability of that area. Regaining vigor, then, becomes less a fight against time and more a logical process of undoing the compression accumulated by modern life. This is the true work of intimate longevity, to stop fighting against age and start working with biology. Now, while muscle tension is the immediate physical cause, it's crucial to understand how our emotional life fuels this tension. The pelvis is the storage place for our unprocessed emotions. How can we begin to release that emotional burden so the body stops creating that muscular armor? The answer, my friends, lies in what we call somatic awareness. We must begin to treat the pelvis not just as a physical structure of bones and muscles, but as the body's emotional hard drive. When life demands too much of us, work pressures, family disputes, the expectation of constant performance, or even the fear of failure in intimacy, the body doesn't distinguish between a physical attack and a psychological threat. Our ancestral survival response, that fight-or-flight reflex, automatically tenses our core to create a protective armor. It's as if we put up an internal shield. The problem is that, in modern life, this state of alert rarely ceases. We live in a state of chronic low-level anxiety, and therefore, that shield is never fully lowered. The tension becomes embedded in the tissues. The levator ani muscle, the coccygeus, and all the deep muscles of the pelvic floor become the silent, chronic guardians of our anxiety, our haste, and our unresolved frustrations. To dismantle this armor, stretching or massaging isn't enough. We need to listen. I propose what I call the pelvic shadow practice. It's a simple exercise in self-inquiry and presence. During the day, in a moment of pause, while waiting for coffee, or before getting up from your chair, take a minute, close your eyes if you can, and simply ask yourself, what am I holding down here? Do I feel contraction? Is it heaviness, tension, haste, or fear that's embedded in my lower belly? Do not actively try to change the sensation. Your only task is to observe with curiosity and without judgment where you feel that pressure or grip. This non-judgmental observation is the first act of liberation. By simply noticing the grip, you are sending a signal of safety and deregulation to the nervous system. I am noticing this tension, but there is no immediate danger that requires you to hold it. This awareness relaxes the connective tissues, the fascia, and allows blood, oxygen, and energy to circulate more freely. This emotional awareness work is the perfect complement to the physical work of the pelvic yawn. One releases mechanical compression, the other releases the psychological compression that perpetuates mechanical tension. Now, let's move on to the second mistake I've seen over decades in the clinic. A mistake that speaks to a lack of faith in our own biological capacity to regenerate function. The mistake of blindly relying only on the magic pill. We're talking about the second trap. Relying exclusively on short-term solutions that mask the core problem without addressing true flexibility and vascular health. This is what I call the quick fix illusion. The appeal of a pill is understandable. It offers an immediate and simple promise, eliminating the need for introspection or discipline. However, these aids, while a blessing in many cases, operate fundamentally in the same way. They temporarily force vasodilation by relaxing the smooth muscle in the arterial walls, allowing for faster blood flow. The problem is that by relying on them, we ignore the root cause of stiffness and unresponsiveness. Think of the pelvic vascular system like a garden hose. If the hose has become stiff and brittle from age, oxidative stress, or lack of exercise, no matter how much water pressure or pill you put in it, that hose isn't going to respond with its youthful flexibility. The problem isn't just the pressure, but the elasticity of the arterial walls themselves. If the arteries don't relax on their own when they receive the signal, The pill acts as a temporary patch, not a cure. The true goal of long-lasting virility isn't to force the body to function, but to restore its intrinsic responsiveness. This requires training vascular flexibility, not just injecting chemicals. How do you train vascular flexibility in such a specific area? Exactly where natural nitric oxide stimulation comes into play. Nitric oxide production is the biological key to flexibility. It's a signaling molecule that tells the arteries, relax and make way. The best way to stimulate the body's own production of this molecule is through rhythmic movement, deep breathing, and direct stimulation of the endothelial cells. We're talking about micro-exercises of pumping and relaxing that are like cardiovascular training for the pelvic floor. When you incorporate the pelvic ritual into your day, you're not only releasing the muscle tension that constricts the blood vessels, error 1, but you're also sending the strongest possible signal for those arteries to regain their elasticity. We're forcing a cycle of gentle compression followed by deep release, resulting in a natural increase in nitric oxide. This, in turn, improves the response. It's a workout for the blood vessels, making the response organic and sustainable, not a temporary chemical emergency. This highly specific and powerful training requires an anchor point, a true master control panel for pelvic circulation. In many ancient medical traditions, especially in the East, an area has been identified that acts as the main hinge between blood flow to the legs, the reproductive organs, and the core. This is where we arrive at the precise location of what in some Eastern schools is known as the €1,000,000 point, or, in simple anatomical terms, the perineum. Let me be very clear about the location, because precision is key to triggering the correct response. We're not talking about a wide area, but a specific, tiny focal point. If you draw an imaginary line connecting the base of the scrotum or the base of the vulva in women, although today we're focusing on male anatomy, and the center of the anus, right in the middle of that line, you'll find a small depression or area of tissue that is slightly softer than the surrounding tissue. It's crucial that you explore this area gently, preferably with the tip of your finger, and notice how the sensation is different from that of the surrounding skin. When you apply very gentle pressure, not painful, but informative, to this center, you will notice a particular sensitivity. It is not a sharp, pricking nerve sensitivity, but a deep resonance, a sensation of awakening, as if you were directly touching the main wire of that vast pelvic circulatory network. Why is this point so important? Because just beneath that skin lie crucial structures, including the central fibrous core of the perineum and, most relevant to us, the deep insertions of the pelvic floor muscles, the famous PC muscles. These muscles, when chronically tight, mistake 1, act like tourniquets. They constrict incoming arterial blood flow and block necessary venous return, impairing elasticity and the filling response. By rhythmically stimulating this point, and I emphasize the word rhythmically because it's not just pressing and holding, but a smooth pumping and releasing sequence, we're sending a direct and profound signal to the autonomic nervous system to relax those internal muscles. Think of it as a muscular and vascular reset button. The gentle, targeted movement at this focal point not only releases tension in those overactive muscles, but also promotes the micro-pumping necessary to stimulate nitric oxide production right in the vicinity of the main arteries that supply blood to the area. It's a combination of gentle acupressure and internal circulatory exercise. When we work on this point using the technique I will teach in the ritual, we achieve two things simultaneously: the release of muscle tension and the induction of vascular elasticity. This ensures a robust response because the body's internal engineering is working in its favor, not against it. It is the most direct and sustainable way to remind the body how to function optimally without relying on temporary external aids. Now, let's move on to how to practically integrate this point into the pelvic ritual. We've broken down the body's internal engineering, understanding that vascular health and optimal response intrinsically depend on PC muscle relaxation, natural nitric oxide production, and rhythmic stimulation of the central vascular point. Remember, we're seeking sustainability and resilience from within, not temporary external fixes. Now I'd like to hear from you. After understanding the power of this internal approach, which of the three pillars of our pelvic ritual, mindset, rhythmic technique, or CV point release, do you feel will bring you the most significant change to begin today? Let me know in the comments. If this journey toward longevity and holistic health has resonated with you, I wholeheartedly invite you to subscribe, turn on notifications so you don't miss our upcoming research, and share this knowledge with those who need it. Thank you, as always, for being part of this community of conscious science. With all my love, Dr. Elena Castillo,